So go and open your mouth, close it, open one more time. See it deviates to the right here? So that means his muscle group on this right side is tighter and it's pulling his jaw to the right. So what we're going to do is we're going to loosen up the masseter muscles on the right side, that when you open, it's hinging it to the right side. Once we loosen that up, the chin will go back to being in the middle, and that'll take away all of his pain and symptoms. Okay? So then what I like to do is I start with the Therapeutic massage gun. So I get the superficial masseter, the muscles on the side, and so as I do this, I'm going to have you slowly open your mouth, and I find a knot, and I work that knot out. I'm just going to keep doing that over and over. So I like to go cross fiber on those muscles, meaning his muscles go up and down like this. So I go sideways, really focus on breaking the knots and adhesions up. Then I go up and down, just follow the muscle group with it. Follow, follow, follow. And then I find a big knot, I put some pressure on there, and break it up, okay? Now open your mouth up. See? More centered already. Good. So the next thing we're going to do is work on the muscle groups manually. So I work from the bottom of the chin. I get all the muscles on the jawline, and toward the end by the ear, you're going to feel some really tight muscle knots and adhesions. I'm going to break those up manually. So you can tell by the face it's really tender for him. So once we loosen that up, then I move up to the masseter muscles here, and I work them one side at a time. So I'm going to have you lean to your left, okay? Then what I'm going to do is I'm going to find the masseter muscle. There's a big knot right here. So I'm going to grab onto it. Go ahead and slowly open your mouth. As he opens, I'm going to put pressure and break that adhesion up, cross fiber. We're going to keep going like that, like that. I'm also going to have you open your mouth. I'm going to follow it downward. Open it up. Open. There you go. Here's some clicking with that as well. But right, there's a really big knot right there that's really throwing his jaw off and causing his pain. So I'm going to work on that. And then one more cross fiber. Okay, and the same thing, other side. This side's not as tight as the other side, but you want to loosen up both. Like he has one right there. So I'm going to work on that too. Close your mouth. Open. Good. Close. Open, 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 open. Good. Come back to the middle. Now, open your mouth. 1, 2, 3, let it go. Open. 1, 2, 3, let it go. Open. 1, 2, 3, let it go. So I do that. I'm basically training his muscles to open up with strength and loosen it up. So right now, open your jaw. See? Now it's way more even. Before it was jutted to the right. Now it's more center. Good. Okay. So now we're going to use the Graston tool. So we've already established that his right side's the tight side. His jaw, when he opens, goes to the right, meaning his tight side is on the right side. So what we're going to do with the Graston tool is we're going to scrape that muscle and find those knots and adhesions. So feel one right there right away. So I'm going to have him open your mouth, and I'm going to, as it's open and stretched out, I'm going to really break it up, loosen it up. You feel that one? That's a nasty one right there. There. Good, good, good. I'm going to use that. Then I'm going to cross fiber, really open it up and break it down. And close your mouth. Now slowly open. Close it. Open, 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 open. There you go. And this one gets really deep. There it goes. Okay. So that would just do that on both sides. Same thing here. Open your mouth. And then this one I use the hook, so I really hook into it, break it up, break it up, break it up. See, there's a knot right there. Perfect. So TMJ patient, way tighter on the right side here. Now I'm going to do the Therapeutic massage gun, and I'm going to do it with the stim, and I'm going to use the balls to roll it out. So he's going to get a little bit of a current to loosen up the muscles, and I'm going to put pressure to break up those knots and adhesions. This one's not as bad as the other ones, but it's definitely effective. It's just easier for me to glide and get those tight knots in there. I like to do a lot of the cross fiber, and as I'm doing that, slowly open your mouth. Open, 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 open. Good. Back. Open, open, open. There it goes. And then I also get under the jaw with this one to get those tight muscles near the ear. See how tight those are? That's good. Okay. So after that, now his right side's tight. We've done a lot of work on him already. So now we're going to put some heat into the area. So with this one, it's really great. With this Theraface Pro, I just basically put this on. It heats up, it loosens up the muscles. And as I'm doing that, I put a little bit of pressure to break up the knots and adhesions to help open up and loosen those jaw muscles. Once these jaw muscles let go and loosen up, the pain in his jaw will go away because now both sides are even and it won't cause an imbalance, and that'll help with the clicking and popping that he's having as well. So right there, feel that one? So open that up, put that pressure, there you go, one more time. Open, 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 good. Okay, good. Okay, so now we're doing cold laser therapy. So cold laser is a light that's going to heal you on a molecular level. So his issue is he has jaw pain and clicking, and when he opens his mouth, the jaw goes to the right. So right now we've done some work on him already. So we're just relieving all that inflammation that we've caused. And the good part about this cold laser therapy has a microcurrent. So now we're going to slowly turn on this microcurrent, which will stimulate the muscles and make them start healing and relaxing even more. So tell me when you feel a twitch or a tingling. You feel it, right? You can kind of see it in his face. So we're going to use that. That's going to go even deeper and break up those knots and make that muscle group start healing for him. And then we go right where those inflammation in his jaw is, where the clicking's coming from. And if it's too much, you could just let me know too. But generally, you don't feel much with this other than the twitching from the microcurrent, but it feels really good afterwards. And I like to find knots and put pressure on them because I like to make things get better as quickly as possible. Excellent. Okay. Okay. So now we're doing the Theraface Pro, the cold head. We've done all the therapy for him, so now we just want to give him some relief and reduce the inflammation. So it's pretty easy. You just put it on, rub it in the areas that we've been working on. It'll take the inflammation down and make the area start healing a lot faster. And I'm just putting some pressure to give it a little bit more of a massage relief for him. That's it. Very simple. Have you open your mouth, close it, open again. We've done a lot of work on you already, so your chin is almost perfect right now. But now we're going to go on the inside masseter muscles and loosen up whatever's remaining. So go open up. For him, it's the right side that's tighter. So I go on the right side here, and I find the knot and adhesion. I loosen it up. massage it from the outside and the inside at the same time. And then the table's already locked in. Now we're going to do an adjustment. So I'm going to lock him in, and there it goes. You okay? Mm-hmm. Okay. Now we're going to work on the other side for him too. So we're going to get on this side, find that masseter muscle that's tight on him there, put pressure and loosen that up. Really open that up, push down. So I'm right on the joint hinge of his. It's out right there. I'm slowly putting pressure onto it and putting it back where it belongs. Okay. Close your mouth, open it. See how much straighter that is right now? So close your mouth again. Let's make sure this is up. Okay, open up. Gonna do an adjustment there. There it goes. Let's do one more, okay? Open up. There it is. Now open, see how you feel? Any clicking or popping?
Just on the right side.
A little bit on the right side. Okay, open your mouth again. Let's get that right area going too. There it is. Yep, open up. Better?
Better.
Done. There you go. So now we've done all the TMJ muscle work, but when it comes to TMJ, we don't just stop at the jaw. We work on the neck and upper back. So we've done the therapy for you already there. And the last part is the adjustment. So we're going to adjust your neck. That's messing with your jaw as well. So tilt your head sideways like that. There it goes. Same thing here. All right, buddy. So if you get up, see how you feel.
Neck is less stiff.
Yeah. And the jaw, how's the jaw doing?
Better than when I came in.
Okay. And then and typically, when you leave here, how much better is it and how's it now?
From like 1 to 10?
Yeah.
Like a 7 or 8
when you come in?
Yeah.
7 and 10, meaning almost better. So
yeah.
2 to 3 then.
Yeah.
Okay. Okay.